In terms of my short presentation at the start, I'm just going to give you an overview of the symposium to whet your appetite of what we're going to do for the rest of the day. And the structure of that is to talk first of all the need, and you've had a flavour of that first up with a video clip, and then talk to the aim of the program and the actual program itself, and then the support that's available. This is an ongoing dialogue as far as the National Blood Authority is concerned and the Commission. We're here to support you in any way we possibly can. So as you're sitting there and saying, gee, they're doing that and doing this, but I wish they'd do this and that, let us know what this and that is, and we'll look at trying to do it. As we go through, you'll see there are opportunities to do other work. In terms of the need, there are two. This is again from the National Blood Authority's perspective. As part of our role to ensure Australia has a safe and secure and affordable supply of blood and blood products, the National Blood Authority has worked closely with the Australian Commission on Safety and Quality in Healthcare to develop Standard 7. We continue to work closely with the Commission now to look at implementing it, and that's what today's about. Standard 7 is part of the wider Quality Assurance and Improvement Program. However, it also directly contributes to the two key outcomes shown from our perspective, and that is improving patient outcomes, and if you like, that's my personal priority. Potentially the way we use blood at the moment is causing harm, and so it's very important to implement the standard to address that. And secondly, more an economic one, but also has some other issues associated with it, is to reduce wastage. In terms of improving appropriate use, as Professor Bister said in the video clip, we think there's a real urgency about it. And we are under no illusion that it involves shifting clinical practice and it involves shifting a belief system. The standard is a key vehicle for us to achieve that. The quote on the screen is from the Patient Blood Management Guidelines, which are based on a systematic worldwide review of the available evidence at the moment. But there's further evidence coming out every day, and the trend is reinforcing some of the points made in that opening clip. In more direct terms, blood transfusion is a liquid transplant that can cause measurable harm with each exposure. The evidence suggests that current clinical practice is resulting in unnecessary transfusions and a potential for patient harm. That said, it is also still life-saving in a range of circumstances. So it's not a matter of it's a matter of moderating what we're doing at the moment. The second outcome of significant interest to the National Blood Authority, and I think everyone in the room, is to reduce unnecessary wastage. Currently, wastage rates vary compared to best practice. The total national cost of wastage is in the order of 30 million. This is simply unacceptable from where we sit. Not only from a cost point of view and resources that could be employed somewhere else, but in addition, it is wasting approximately 70,000 donations. So that's 70,000 donors' time and effort to provide product that's being wasted. So perhaps the more important point. Obviously, some wastage is necessary, but as you can see from the figures there, we're a long way from what we would see as being acceptable. In terms of the symposium aim, it's to support you. This is all about you today. Support you implementing Standard 7 in your facility. The resulting, and in terms of that aim though, it's not going to give you all the answers. What it's going to do is give you an overview, it's going to give you some tools and hopefully spark your interest. More than likely it will create more questions than it will answer. So as I said, an emphasis here is to find out where material is for you to follow up once you leave this symposium today. Also to talk to your colleagues. I mean, some of the best lessons and some of the best practice is in this room now, I know that. Simply that you're here, you're interested, and I'm sure you're doing lots of good work in your facility. In terms of the program, in the first instance, we'll provide an overview of the National Safety and Quality Health Service Standards, and the Commission will address that. Then provide a clinical perspective of the standards in practice. That provides a broad background to then drill into the 4 criteria that are listed in the standard. And you'll find the way this is structured is we start at high level and increasingly we come down to detail to hopefully provide you with tools that you can use practically. In terms of criteria 1, governance and systems for blood and blood product prescribing or use, the standard requires health service organisations to have systems in place for the safe and appropriate prescribing and clinical use of blood and blood products. Criteria 2, documenting patient information. The clinical workforce accurately records a patient's blood and blood product transfusion history and indications for use of blood safely and efficiently. Criteria 3, managing blood and blood products safely. Health service organisations have systems in place to receive, store, transport and monitor wastage of blood and blood products. Obviously that criteria goes to the wastage need. And the final criteria, communication with patients and carers, and that talks to the requirements of having, in case, a consumer-informed consent program where consumers or patients and carers are aware of the risks and benefits and the alternatives. And the shift there is it's not just a box on a consent form that said you consent to transfusions, but the patient has run through what the risks are, the benefits, the alternatives, and a plan, an appropriate plan for them. Each of the sessions, as I said, seeks to strike a balance between the background theory and practice. The symposiums are only one part of a program that we're running with the Commission, and certainly in Victoria. Victoria's running programs as well, as is every other state. And what we're trying to do at a national level is bring those together and draw on best practice. So there is a lot of other support available to you. What I intend doing is just giving you a flavour of that support. The National Blood Authority, in collaboration with the Commission and states and territories and other key stakeholders such as the Blood Service, are developing a range of measures to support you. These are outlined in 2 3-year strategies. One, the National Blood Wastage Reduction Strategy and the National Patient Blood Management Guidelines Implementation Strategy. Generally, the supporting measures for these fall into 4 main groups: awareness and promotion, best practice tools, education and training, and data. I'm going to give you a quick overview in each of those spaces or what's in those spaces. If you're interested, those documents, those strategies, which list the activities and the timelines for them, are available on the National Blood Authority website. The first one is best practice tools. The National Blood Authority is and has published a range of tools, best practice tools on the website to support implementation of improved inventory management and patient blood management. These form part of what we call a national reference set. So many of the states are doing lots of good work, but there is a good piece of work in this state, another good piece of work in that state. Blood Service may have a good piece of work, but there's nowhere where it's drawn together and there's a lot of duplication. So we're drawing on that existing work to create a national reference set, which will also provide references where we think there's a more authoritative area for you to go. The first of these are seen to be easier to implement. So the way we've designed the tools that are going up, and in your packages you would have seen a tool on restricted usage. That's seen as a nice compartmentalised tool that you could use. So some of the tools are there. Improved inventory management tool is also up there. But as over the next 12 months, there will be more and more of these. We're acutely aware that implementing a patient blood management program, as an example, is a pretty arduous undertaking. It takes a lot of resources, a lot of effort, and over a sustained period of time. So if you're at the hospital level, that may be too big of an ask. But what you can do, and the way the tools are designed, is you may be able to take a particular area as a restricted use, cell salvage, and implement that. What that does is potentially you'll realise success provides a foundation for building on that for more success. As I mentioned, in your satchels you would see that in fact released this week is a restricted use policy based on existing best practice across the country, brought together, reviewed by experts and interested interested stakeholders across the country. It provides you with templates to download and modify for your hospital, and this includes badging. We're not trying to prescribe this is the way to do it. We're fully aware that every hospital is different, and what may work in one hospital may not work in another hospital. So these tools are designed for you to download, to modify to meet your need. You may not even want to use all the tools. If you look at the restricted use tools, there's a whole bunch of stuff there that some of it you'll say, no, I don't need that, but that's a good idea. You may want to change the logo on it, but it provides you a starting point and something to think about. One that's currently out for, and the second major one out for public consultation at the moment, is intraoperative cell salvage. It provides a package of tools that talk to cell salvage as a recommended alternative to allogeneic blood transfusion. And the reality is a blood transfusion is like liquid organ transplant, and even under ideal conditions, it's not as good as someone's own blood. And again, it's one small compartment. If you don't do anything else but you implement cell salvage, you will have improved your management of blood. As I indicated, the NBO will be publishing a further 20 or so tools. You'll also find a growing number of case studies. At the moment, if you go to our website, you'll see a range of case studies of best practice in relation to inventory management. Those case studies are interesting in that if you actually have a look at them, there's some points of practice in them that are diametrically opposed. One hospital's doing it one way, one hospital's doing it the other way, but they're both achieving great results. Their wastage figures, here we're talking about 0.5%, 0.6% of these particular hospitals. So that's what's achievable, acknowledging that every hospital's different and you may have remote sites that create difficulties, but it gives you a flavour of what can be done. And again, there's no perfect solution. It's quite amazing that you can do two opposite things and get a great result. In addition, as I mentioned, today's presentations and other symposiums are being filmed and they'll be on our website within 2 weeks. On case studies, if you've got a great story to tell, let us know. We'd love to come out and hear your story. We're starting this series on patient blood management. If you've got a great story, tell us. We would like to promote your success and celebrate your success. As indicated, the NBO will be publishing a further 22 or so tools over the next 12 months. This includes everything from draft business cases to patient consent templates. Each of them is based on existing work by a state and territory, which is then refined for you to download and badge as your own. We recognise that what works in one hospital may not work in another, and so they are designed to give you options to amend, modify, as I've said before. We're also inviting public comment on them with an ongoing program of public consultation, and a broad outline of that public consultation is shown. There's a lot of activity there, so really I'm inviting, if you've got a particular interest in a particular area, we'd welcome your comments, welcome your involvement. Welcome your suggestions of other tools that you think you need. An example of little ideas. I mean, this program in implementing the standard advances on a wide front. There is no silver bullet. So you'll see a range of different activities in different areas to try and support you. Most recently, a price on a unit of blood. Now, there's many people said that's not a good thing, it's counterproductive, and then there's others that thought it was a good idea. Generally, it's pitched at the wastage area to say blood is a precious resource. Not only that, it's expensive. So it should be used with care, particularly in the wastage space. On the data front, those who are aware of BloodNet, there are a range of new BloodNet reports coming out which provides you with the ability to produce your own wastage reports. Very hard to improve. You can't measure where you were, where you started from, where you are now, and where you want to end up. Those reports are progressively being rolled out, and more are coming over the next 6 months. Again, my emphasis here, even though we're from Canberra, we are listening actively to you. That group up there is the BloodNet user group. They're the ones that we're consulting on which the reports are based. If you'd like to participate in any of the forums or the public consultations, also let us know. I mean, we're trying to ensure that what we deliver is what you need. In the education and development space, our flagship for this is Blood Safety Learning Program. In addition to the modules that already exist, and probably most people here are aware of that program, we're currently developing, or they're currently developing, patient blood management program modules. It's been a very successful program. The figures in terms of people that actually log on and complete those modules run into the hundreds of thousands at the moment. So I'd certainly encourage you to go to that site. I'll conclude the intention of this particular opening presentation was to do a once-over lightly of the aim and program for the day and some of the wider support available to you. My last slide is a good news story. The chart shows that we're already making progress, and I put a lot of that down to the standard. If you look at the July blue bar, this time last year, or approximately this time last year in July, and these are national figures, blood demand for red cells was increasing at 4% compared to 12 months prior. 12 months later, now in August, which is the red bar, compared to 12 months ago, real demand has declined by 13%. That is a pretty impressive figure. So, we think this is actually on the front end. I mean, it's a great sign, but it's actually the front end of the change necessary. In terms of blood management, it's a really, most of the storyline is a win-win. What you have is, by implementing effective blood management, both in the PBM space and inventory management, and implementing the standard, is you save resources that can be redeployed somewhere else. More importantly, from the National Blood Authority viewpoint, you're actually improving patient outcomes, which is really, most people in the health sector, that's why they're in the health sector. That concludes my presentation, or the overview. Are there any questions? It was really only intended.